I want to share about something I find so frustrating and upsetting. And that has to do with when people or patients in general don't receive enough information in order to be able to make informed choices about their healthcare. Specifically, I'm thinking of women who've been diagnosed with HPV. You see, I talk to women every day and every week, thousands of them from around the world. And I've heard all kinds of stories of them feeling alone and afraid and really trapped with this virus in their bodies, not knowing how to get it to leave them alone and how to prevent it from causing cancer in their bodies. And the thing I hear over and over in these stories is that these women didn't have enough information from their doctors. And so I feel passionate about trying to be able to share as much information as I can about HPV and your options so that you can make more informed choices for yourself and your health at earlier stages in the process of finding out that you have HPV. You see, HPV is actually a very common virus. The studies show that about 1 in every 2 people will have HPV at some point in their lives, that over 80 million Americans have the virus or even had the virus several years ago, and probably more have it active at this point in time. And so it's a very common virus. But still, when women go in to see their doctor and when they talk, if they choose to talk to people in their life, there's a perception that this is a virus that occurs when a person is being maybe thoughtless or not careful about their sexual activity. And the truth is this virus is so common that even people who with very low amount of sexual activity can have this virus. I've heard from people who only had one sexual partner in their life who have positive HPV. So it's really not about number of sexual partners. It's about your susceptibility to the virus activating and causing abnormal cells. And so that's one of the first things I want you to know is there really should be no shame or embarrassment about having HPV positive. It really should be where you're feeling supported and informed about your choices going forward from here so that you can help your body fend off this virus. Because what I've seen, and this is over 21 years in practice, helping women and men with HPV, is that my patients are able to fend off that virus and get it to leave them alone. So they're no longer feeling trapped in their own bodies with this virus. One of the most upsetting stories I hear is women who have received a pap smear that showed HPV and maybe also showed abnormal cells. So these women did what they were told to do, which is the right thing to do, which is they had a pap smear. They got abnormal cells. They had a colposcopy, which is a biopsy of the cervix to clarify and get more specific answers about how severe the abnormal cells are. And they did that. They listened to their practitioners. On the colposcopy, maybe it showed a low level of abnormality, which might be CIN1 or CIN2. And they did a LEAP procedure, which is a laser treatment to remove the abnormal cells. And the doctor said, come back in 3 months or 6 months and recheck. And these women did that. They went back in, they got rechecked in 3 to 6 months. And it was still there. Even though they had the abnormal cells removed, the virus is still there. A lot of times women are not told that the procedure to remove the abnormal cells doesn't kill the virus. So the virus can cause abnormal cells again. Many times I hear stories of abnormal cells recurring within 6 months to 12 months of having a laser procedure. And the treatment is, again, another laser procedure. So sometimes women are having a LEAP to remove the abnormal cells over and over and over and over again. And this might be every 6 months or every year. And even once they have a normal pap smear or a less than severe pap smear, they still have to go in and have pap smears and colposcopies every 6 months to a year. So this means more visits to the doctor, more biopsies, which is a painful procedure. And these LEAP procedures can actually damage the cervix. So if these women are thinking of having a future pregnancy, it could actually affect their ability to maintain their pregnancy. And a lot of times women are not told that this could go on like this, that they go on and on for years. And women are telling me how they feel like they're on this just merry-go-round they can't get off of. And once you've had one colposcopy, the doctor's going to want to do another colposcopy in order to be able to compare apples to apples. So they're going to do one colposcopy, and then in 6 months, they're going to need to do another colposcopy and another colposcopy. And so next thing you know, you've agreed to this procedure once, and next thing you know, you're going to have to do the procedure again and again and again, because the procedure doesn't remove the virus. The thing that's going to get the virus to leave you alone is changing your health, changing your body's ability to fend off the virus. But the doctors don't tell you that, and they don't have a treatment for the virus, no prescription for the virus. And so they just tell you to keep coming back, wait and recheck. And it gets to be very draining on women because they feel like there's not really space in our community or our society to talk about this stress that they are under, constantly worrying about this next pap and colposcopy and how the results are going to come back. And worst of all are the stories of women who have had the cells advance on the cervix, so much so that they had to have the cervix removed. Now, this is usually only when there's cancer in the cervix. So they remove the cervix and they leave the vaginal tissue. The thing is that a lot of times they don't tell women is that the virus can then cause abnormal cells and even cancer cells in the vaginal tissue. So even if you have your cervix removed, even if you have your uterus removed, so sometimes women are having a hysterectomy to remove the cervix and the uterus, and they're not told that the virus could still cause abnormal cells in the vaginal tissue. And so many women I talk to come to me in tears to find out that they went through all those procedures, had a hysterectomy, cervix removed, and they end up finding out that they have abnormal cells in the vagina because of this same virus. And even then, they can remove the vaginal tissue, but still these women have left in their mind, where's that virus going to cause abnormal cells next? HPV is known to cause abnormal cells in the anal area. For men, it can also cause abnormal cells in cancer, and HPV can cause abnormal cells in the oral mucosa as well. So this virus doesn't give up easily, especially when your body's worn down and depleted by stress. And the thing is that simply having this virus and going through the medical procedures associated with it is stressful. So it ends up that addressing this virus through the conventional approach leaves you in a stress state that leaves you more susceptible to the virus. And so it's a real catch-22. And so what I do is I really believe that once you understand this situation that you can find yourself in, I want to teach you to outsmart it, how you can outsmart this virus. And yes, you need to be able to do these medical procedures when they're necessary, but we also want to be able to think ahead to be able to stop this virus so that you can get off of this. You can be done with this. You can actually get to the point where your pap smears are coming back normal, one after the next, and even have the HPV testing negative, one after the next. When that happens, what a relief. you've now prevented this virus from causing abnormal cells, but you've also been able to get yourself out of this recurring, repetitive torture of stress and procedures and fear of what this virus could do. And that's why I feel so empowered to help you with this virus, HPV. It went way back over 20 years ago, 25 years ago, when I was first learning about HPV and how to help people with it. I wasn't sure. I was like, well, I'm going to do what my mentors and instructors are teaching me to do and what I read in the studies, and I'm going to apply that. And I was so amazed to have women come back and say, oh my gosh, my pap smear is better. The HPV is negative. So I kept on helping more women. And again, at first I was like, well, I'm going to give them everything I know and let them use that information. And then they would come back to me again saying, Dr. Doni, my pap smear came back completely clear. My doctor says, come back in 6 months. And then when they go back, it's still clear. And then they can come back in a year. Like, to them, that's so long because they've been having to go in every 3 to 6 months. To say, oh my gosh, you can come back in a year is like the biggest celebration. And then from there, it's normal again. And they can just go back to the usual pap smear testing schedule. It's such a relief and it's so empowering for women. And what I end up seeing is that for women who are still wanting to have a pregnancy, what we do to help fend off this virus and correct the abnormal cells actually helps them prepare for pregnancy, because pregnancy is more likely to happen when you're at your healthiest state. And you're more likely to be able to fend us this virus when you're in your healthiest state. So what my protocol does is help you to get to your healthiest version of your body, to reset your genetic expression, to use epigenetics for good purposes, to reset your genetic expression so that your body can use your nutrients in the optimal way. And we can use herbs and we can use nutrients in the clinical doses that are antiviral and immune supportive. And we can help your body recover from stress, heal leaky gut, heal your adrenals, and get it to where your hormones are in balance, and identify any toxins or stress exposures that might be in stopping your immune system from fending off this virus. And you end up healthier than you ever have been. And that's when you can fend off this virus. And that's also when you're going to be most fertile. In fact, a lot of my patients, I say to them, this is going to make you, this protocol makes you more fertile. And lo and behold, a lot of patients end up calling me, toward the end of their protocol, telling me they got pregnant, whether on purpose or unintentionally, because their fertility increases so much that they end up getting pregnant without even really trying, so to speak. And then we can shift gears and we go from addressing HPV to continuing a healthy pregnancy, which is, again, so exciting, because by then we've managed the virus and the abnormal cells, and now they're ready to have a healthy pregnancy.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care. Daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdoni.com.
I also hear from women who are postmenopausal, say in their 50s or 60s, who have HPV come back positive, and they're thinking, how did this happen? The thing about this virus is it could be in our bodies for years or decades without it showing up. And then all of a sudden, when we're under more stress and we have hormonal fluctuations and we have changes going on in our lives, all of a sudden this virus becomes activated. And it's, again, stressful for these women, especially because when you're already through childbearing age, a lot of times the standard suggestion from a practitioner is to have a hysterectomy. They're figuring you don't need your uterus for having a baby, so let's take out the uterus. But the thing they don't tell you is that even if you have your uterus removed, this virus could still cause abnormal cells. And a lot of women don't want to have a surgery and have their uterus removed unless they really need to. And many times this might just be mildly abnormal cells that I can help you correct. Your body can grow new healthy cells on your cervix. And I can show you how. The cervix, think of it like skin, right? The skin sloughs off and we can grow new healthy skin all the time. Well, the same thing with the cervix. We can support your body to grow new healthy cells on your cervix, no matter what age. Even if you're over 50, I see it all the time. We start a protocol, even though the doctor is saying, hey, it's CIN2, it's not cancer, but you're postmenopausal, let's just do a hysterectomy. And the patients call me and say, I don't want a hysterectomy. Hey, I'm done with my menstrual cycle, but I really don't want to have my uterus and ovaries removed. Is there some other option? And I want you to know there are other options. We can help your body fend off the virus, and we can help your body grow new healthy cells on your cervix. And I can't even tell you how exciting it is when I get to celebrate with a patient who has chosen to this path, who has chosen to listen to what she's really wanting for herself and her health and her body. And it does take some courage, because sometimes we're used to listening to, the standard medical approach. And it takes some courage to say, hey, you know what? I want to do something different for my body. We want to do it in a safe way. Of course, we don't want anyone to have cancer cells or to ignore this virus or to ignore the abnormal cells. That's not it at all. Of course, it's how do we actually pay attention to it in such a way that we can help your body hopefully heal the abnormal cells and address the virus without you having to have a procedure or a surgery whenever possible. And what I've seen is that a lot of times it works. Actually, more than 90% of cases that I work with, this works. And so that's why I feel comfortable sharing it with you, is because I will just want you to know, if you're out there searching, if you had this thought of, is there some other option? Is there something else I can do? Is there some other possibility here? If you've been wondering this, then I want you to know, yes, there are other options. There are other possibilities, and there are women who have done this successfully. There are women who said to their doctors, I'm just going to wait on the hysterectomy. I understand the suggestion, but let me just wait. I'm going to try some diet changes, some vitamins and herbs, some support for my body to recover from stress. And I'm going to be back in 3 to 6 months to redo my pap smear and colposcopy to recheck it and evaluate my progress. When you tell your doctor that you're going to be proactive and you're going to be back to recheck on it, most doctors will be fine with that, because they really, I think, would love to see your body heal on its own, right? So you just have to communicate with your doctor, and then you go through the process. I have a protocol that I can either guide you one-on-one or in my group online class. You go through this protocol, you go back to your doctor or go to a new clinic and get retested for your pap and colposcopy if you need a colposcopy, and find out how much progress did you make. Usually we see at least some improvement. And a lot of times it's completely resolved within 6 months. Sometimes we need a little longer, depending on the severity of your case and all of your other health factors and how well you're able to implement the protocol. then you might need to go a little bit longer to fully get the cells to normal and the HPV to negative. And certainly there are some cases where we need to go even to the next level. To me, it's always we need to match for your body. So we might start implementing in kind of a ladder. We start here, we implement this much, and we see how much progress does that make for your body. If it's not enough progress, we up it. We go, okay, what else do we need to do to really help your body fend off this virus? Because what I find and what I've seen over all of this time is that the majority of cases, we can fend off the virus and we can free you from this torture that HPV can create in your lives. And I want for all of you to be able to have that information. So I'm saying it here in this video, and I also write blogs about it. I have a free guide, PDF that you can download to read more about my approach. I also have a webinar. I'm going to be doing the webinar live here in a couple days. So I welcome you to sign in and join me live and bring your questions. I also have a course where you can sign up and do the course at any point in time. It's a 6-week course where you get videos from me on exactly how to implement my protocol and design this for you in your life. And I also work one-on-one with patients when they really want that one-on-one support to implement my protocol and what I've found to be most successful from all the cases that I've worked with over the years. So I invite you to please reach out to my office, and we can connect with you individually and help guide you into what would be the best solution for you at this point in time. Some of you might just have HPV and no abnormal cells. And that's a really important time to work on this because we want to stop this virus from causing abnormal cells. Some of you may have HPV and some abnormality, and it's important to distinguish how severe is it, because the right approach depends on how severe the cells are. So if they're mild, that's a different approach than if they're moderate, than if they're severe. And some of you may need to be going through a medical procedure, say a LEEP or a cone biopsy or a surgery. Some of you may need to be doing that, but still what I would suggest is that we work on helping your body fend off this virus, because again, even if you have a procedure to address the abnormal cells, the virus can still remain and it can cause abnormal cells all over again. And I want to help you stop you from getting into that pattern of thinking you've treated it and it comes back again, because it can really affect your life. It can really affect your relationships and your mood and even your work and your ability to take care of your kids and your state of stress in your day-to-day life. And I just want for you to be able to experience something different. I want you to be able to experience the empowerment of learning what your body needs. Because what I find is once the patients I work with, once you learn what your body needs to be healthy, then you'll be able to carry that through into your life. You don't have to continue the protocol at the same dosing forever. Once the pap smear comes to normal, then we have a maintenance plan, and you're only just using a maintenance doses. And those same maintenance doses to prevent HPV from causing trouble again, those are the same maintenance doses that are going to help you fend off lots of other health issues, from heart disease and diabetes and dementia and cancer in general. So the maintenance protocol is really a maintenance protocol for helping you stay healthy in general. And so it's definitely possible to, you start in, we do what we need to do to fend off the virus and help your body get back to a healthy, balanced state. And then once you get back to what I call resiliency, once you get to resiliency, it's about how do you maintain that over time. And by maintaining resiliency, you're going to fend off HPV as well as many or most all other health issues. And as I talked about, it's going to improve your fertility if that's one of your goals, or just preventing, improving your longevity by preventing other health issues over time. So I just, really wanted to share that today, that why I'm so passionate about helping with HPV and what I see in the women that I work with. And these women then say to me, thank you. First of all, they feel so grateful for the opportunity to shift the path of their health and to have the information they need in order to do that, and the empowerment to feel confident and certain about having a strategy that's most likely to get them there. But also these women say to me to please try to share with more people and more women what's possible, because once they go through this, they feel like they want everyone to know that it's possible to address HPV, and that it's not something you're going to hear from the usual doctor's office, because this is not something doctors are trained to do. So of course they don't have that information to provide. And so you just have to know that when you go into the doctor's office, they're going to have information about the procedures they can offer, but they're not going to have information about the things that they don't offer. And their education doesn't include clinical nutrition or herbs or healing leaky gut and adrenals. That's just not part of their education. But I'm a naturopathic doctor and a midwife, that is part of my education. It was a huge part of my education and my residency and my internship. And it's also one of the most common conditions that I've helped with in my practice for over 21 years. So it's just happens to be something that I became my expertise over time. And that's why I'm here to share it with you. And I'll share links with this video so that you can access more resources and ask me more questions. Whatever it takes to help you on your path is what I'm really here to do. And there's no judgment. There's no judgment about having HPV. There's no judgment about what you choose. Some people choose to have a LEEP or need to have, different procedures. There's no judgment. I'd rather you have the information so that you can make an informed decision. And then from there, we're here to support you so that this virus doesn't have a chance to cause abnormal cells again if we have anything to do with it, right? If we can have anything to do with it, let's make it so that your body knows how to fend off this virus for you. And so then you can go on and do the things you really want to do in your life without having to constantly fear HPV. Thanks so much for listening to me today. And I look forward to seeing you and talking to you as you join me more in some of the resources I'm sharing. My hope is that this continues to help more and more women to have the information and hope and vision that something different is possible for your health, especially in regards to HPV.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.